we're going to discuss a topic that often generates mystery and curiosity. What happens to a man's body when he goes a long time without sexual activity? As you'll learn, this is a very common question. However, the answer is more complex than most people believe. Sexual abstinence is not simply the absence of intimate relationships. It can also cause a series of physical and emotional changes. It's important to understand these changes in depth because they can have a significant impact on various aspects of the human body. Let's start by talking about sperm, those tiny and microscopic sperm that are crucial for the survival of our species. What happens to them if a man doesn't ejaculate? Contrary to popular belief, sperm are not stored in the body forever. Our organism has a recycling system that prevents their accumulation. Imagine it as a constant process of renewal. Old sperm naturally degrade, and their components are reabsorbed to be reused in the creation of new sperm. This recycling mechanism keeps the male reproductive system in balance and ensures its proper functioning, even when there is no sexual activity. It's the body's way of maintaining homeostasis to ensure everything works as it should, even without ejaculation. The fact that sperm do not accumulate in the body is quite fascinating. Instead, they follow a natural cycle of degradation and renewal. The body constantly replenishes itself, preventing any harmful accumulation and allowing the reproductive system to remain in optimal condition. The male reproductive apparatus can function even when sexual activity is not practiced. This allows the body to be in balance and free from any reproductive implications caused by a lack of sexual activity. This natural process of sperm rotation helps explain why abstinence from sexual activity has no negative impact on the male reproductive system. Many people believe that not ejaculating regularly over long periods can cause sperm accumulation. However, in reality, the body recycles sperm so that no harmful accumulation occurs. The male reproductive apparatus can function normally even during long periods of inactivity. Understanding this natural process sheds light on how our body maintains its reproductive health without the need for constant sexual activity. It's a good reminder of what the body can be and its ability to self-regulate in response to different conditions. The body can maintain its reproductive health without the need for constant sexual activity. This recycling process is one of the many ways the body can adapt to different situations and maintain balance. Now, let's talk about the fluid that transports sperm, semen. It is composed of an extremely complex mixture. Semen is produced by various glands, such as the seminal and prostatic vesicles, and contains sugars and minerals that protect and nourish sperm on their journey. These substances are essential for the viability of sperm and their ability to fertilize if the opportunity arises. Semen production does not stop completely when a man does not ejaculate, but it significantly decreases. The fluid that is not ejaculated is recycled by the organism in the same way as sperm. This prevents saturation and overproduction of the reproductive apparatus. The body regulates the production and recycling of semen in the same way it does with sperm to ensure balance and proper functioning of the system, even when there is no sexual activity. The next gland to discuss is the prostate. This small gland can be a concern for men as they age. There is a widespread belief that men who do not have sexual relations are more prone to developing prostate-related problems, such as benign prostatic hyperplasia or prostate cancer. Is this true? Sexual activity and prostate health are more complex than initially thought. According to some studies, a higher frequency of ejaculations could have a protective effect against prostate problems. This suggests that regular ejaculation can help reduce the risk of conditions like BPH or prostate cancer. Other research has not been able to establish a direct or consistent relationship between sexual activity and prostate health. We know that a healthy diet, regular exercise, and stress management are essential for maintaining prostate health, regardless of the sexual activity a man engages in. Although sexual activity can influence prostate health, it is not the only important factor. Other lifestyle choices play an equally important role. Let's address a concern that worries many men: the size of the genital organ. The topic is often filled with myths and misconceptions. One of them is that a lack of sexual activity will decrease the size of the penis. This is not true. The size of the genital organ is genetically determined and not by sexual activity or frequency. It is true that men may notice subtle changes in their bodies as they age. This includes a reduction in tissue elasticity. However, this is not due to a lack of sexual activity. It is natural for men to age and lose elasticity. This can cause subtle changes in the appearance of the penis. This is not due to the absence of sex, but is part of the aging process. Although age can affect the body, it is understood that sexual inactivity does not have a significant impact on penis growth. Studies help dispel myths about aging and allow for a better understanding of the natural process. This reinforces the notion that changes in the body are not solely due to the absence of sexual activities, but to a series of factors. Our bodies are complex, and various factors, such as genetics, lifestyle, and overall health, influence how we age. Summary: although sexual activity can influence some aspects of male health, such as sperm and prostate health, there is not enough evidence to prove that a lack of sexuality causes reproductive problems or penis shrinkage. It is more important to adopt a healthy lifestyle and maintain a balanced diet. It is also essential to exercise regularly and treat any underlying diseases. This is a better approach to overall health than focusing on the frequency of sexual relations. Now, let's talk about sexual desire, that drive that leads us to seek intimacy. Libido, an important component of sexual health, can be affected by many factors, including emotional, physical, and psychological ones. It is common for sexual desire to gradually decrease when a man remains inactive for long periods. This is similar to the weakening of a muscle after not being used. It is a normal physiological reaction as the body adapts to the lack of sexual stimulation. It is important to note that this decrease in desire does not last forever. Often, a man can reactivate desire if he resumes sexual activity with his partner or through masturbation. A healthy lifestyle can also contribute to healthy libido. This includes a balanced diet and regular exercise. A balanced diet rich in essential nutrients can directly impact sexual desire. Regular physical exercise helps maintain energy and stimulate circulation, while stress management techniques such as meditation, deep breathing, or adequate sleep can contribute to emotional well-being. All these factors contribute to maintaining sexual desire. A holistic approach to mental and physical health can help maintain and even revitalize sexual desire. This is especially true when sexual activity has decreased for some time. Choices can also change. During periods of inactivity, erections may become less frequent, especially as men age. The aging process is responsible for this decrease in frequency as hormone levels fluctuate. Erections may become less frequent and less rigid as we age. However, this does not mean losing the ability to have erections. Even without sexual activity, a healthy nervous system and circulatory system, responsible for erectile functions, continue to work. Even nocturnal or spontaneous erections during sleep are an indication that the nervous and circulatory systems are functioning correctly. They demonstrate that the body can still achieve an erection without conscious sexual stimulation. It is also important to consider hormones, and particularly testosterone, which play a vital role in sexual desire as well as other bodily functions. Testosterone levels are influenced by various factors, such as age, health, and sexual activity. A lack of sexual activity can have a negative impact on testosterone, but this relationship is complex and not fully understood. Studies suggest that sexual activity can help maintain healthy testosterone levels. It is a natural way to stimulate the hormone. It is important to understand that testosterone levels fluctuate due to a variety of factors. Sleep quality, diet, physical activity, and stress management all play a role in hormonal regulation. Summary: although periods of inactivity can affect sexual desire and testosterone levels, these changes are usually temporary and can be reversed by adopting healthy habits or resuming sexual activity. It is important to maintain overall health that includes good nutrition, physical fitness, and stress management. Understanding the complex relationship between sexual activity, hormones, and overall health allows men to address changes in sexual health and respond in a way that meets both their physical and emotional needs. It is also important to consider emotional well-being. A lack of sexual activity can affect mood and emotional health. Sexual intimacy stimulates endorphins, chemicals that increase feelings of happiness and pleasure. These experiences are necessary to avoid feelings of depression, loneliness, or frustration. To minimize the impact of these feelings, it is important to maintain positive relationships, develop self-esteem, and adopt habits that promote mental health. Remember that sexuality is an important part of many people's lives, and its absence can have emotional effects. Understanding the natural aspects of sexuality is essential for mental and physical well-being. Wet dreams are those dreams in which involuntary ejaculations occur during sleep. It is not uncommon for these episodes to be more frequent after prolonged periods of sexual abstinence. The body uses this natural mechanism to deal with excess semen. Wet dreams are not harmful to health. They can serve to release accumulated sexual tension. A lack of sexual activity in men can cause various changes in the organism, including a decrease in sexual desire and the frequency of erections, hormonal changes, and even emotional and mood changes. It is important to realize that each person responds differently to the absence of sexual activity. It is essential to prioritize a healthy lifestyle. Seek professional advice if the lack of sex begins to affect physical or emotional health. Now, let's talk about masturbation. This practice is often surrounded by myths and taboos. Masturbation can be a healthy and natural way to explore your sexuality. Contrary to popular belief, masturbation does not harm health. In fact, it can have positive effects such as improving sleep quality and reducing stress and mood. It does not replace relationships, but it can be a good alternative to satisfy sexual needs. Let's change the subject and talk about sexually transmitted diseases. These infections are mainly transmitted through sexual contact, as the name suggests. The absence of intimate relationships seems to reduce the risk of contracting diseases. It is important to note that certain diseases can be transmitted through skin-to-skin contact, so even without penetration, the risk of transmission remains. Urinary tract infections in men, which affect the bladder or urethra, are also important. The absence of sexual activity does not have a direct effect on the development of these infections. These infections are usually associated with other factors, such as prostate problems or bacteria in the urethra. While sexual activity can increase the risk of infection in women, the same does not occur in men. Now, let's talk about vasectomy. It is a surgical procedure that prevents sperm from leaving the body during ejaculation. This procedure does not affect semen production or the ability to have an erection. After a vasectomy, the ejaculated semen does not contain sperm. It is a permanent and effective method of contraception. Let's conclude with premature ejaculation. This condition is characterized by ejaculation occurring before the desired moment. This condition is not caused or worsened by a lack of sexual activity, as many people think. Premature ejaculation can be due to psychological factors, such as anxiety or stress, and not sexual activity. The topics discussed here demonstrate that, although sexuality is a vital part of our lives, there are still many myths surrounding it. To lead a happier and healthier life, it is important to stay informed and seek specialized help whenever necessary. It is true that regular sexual activity can help control premature ejaculation. However, it is not the only way to do so. There are many approaches to controlling premature ejaculation that include behavioral strategies, therapeutic techniques, and, in some cases, medical treatments. Now, let's talk about erectile dysfunction, a condition in which a man is unable to achieve or maintain an erection firm enough for sexual activities.